Broadcast is now starting. All attendees are in listen-only mode.
Hello, everyone. I am Eric Lufer, the president of the Citizens Research Council. It's my pleasure to welcome you to our webinar, briefing everyone on our recent paper, Social Determinants of Health, Pathways to a Healthier Michigan. The Citizens Research Council is a statewide not-for-profit organization that does public policy research on issues important to state and local government in Michigan. This is our 109th year of operation, a longevity we attribute to our independence, our goal to make government better without having a lens to make it smaller or bigger or more progressive or more libertarian, but just good government that works for everyone. We like to think we're the most trusted voice on public policy in Michigan. We're a private not-for-profit organization. We rely on charitable contributions of foundations, businesses, corporations, and individuals. It's the end of the year, and if you're getting our emails, you've seen a few suggesting that you might think about us with your end of the year giving, and we hope what you hear today will reaffirm the value of our organization and you might think about lending some support. The webinar we're going to discuss is a paper, as I said. You can find that on our website, and there's a summary that goes along with it. Karley will be the first to tell you that it is a really big paper, so it takes a bit to get through. But the summary is very readable, and we hope you'll find value in it. Karley joined us in 2022, prior experience with the Legislative Service Bureau in the state and several degrees from the University of Michigan. While with us, she's been doing a lot of work in health, particularly for this paper, public health issues, but also issues of human services, education, criminal justice. The webinar is being recorded and will be posted to our website shortly after the webinar concludes. It takes a little time for the software to process it and for us to get it loaded. So you'll be able to come back and revisit it or share that link with others that you think might be interested in it. We will not be taking questions orally, but there is a question feature in the software for this webinar software, where you can ask questions. We'd really appreciate to hear your questions. And when we reach the end of Karley's presentation, I will pose any questions that you've asked to her. So with that, let me turn it over to Karley, and thank you all for joining us.
Hi, everybody. Thank you for joining us. I'm going to give you a little bit of background about the paper that we have been working on. It's a project we've worked on for almost 2 years. We recently published it November 18, 2025. We're going to discuss the findings and the conclusions today. But like Eric said, this is a very large paper. It includes a lot of specific data on a lot of different things. If you know anything about social determinants of health, you know that that covers a very wide range of different things that you can talk about, a lot of different things that you can measure. So we're going to give you some highlights, but the report is pretty thick with a lot more of that data. The kind of origin of this paper, we had previously done work on our slow population growth in the state, and health of Michigan residents is lagging behind. And we also know that there's this general interest in social determinants of health and trying to contextualize those health outcomes and the reasons for why those health outcomes are lagging behind the US average and behind other states. And social determinants of health is kind of sometimes for some people a little bit too broad or vague to fully understand, and we really wanted to make it more tangible for policymakers and give them kind of a framework for understanding how they could apply this to policy. Really providing this grounding that, you know, public health is more than just health policy. We really need to zoom out and focus on other areas as well. So just a quick overview, the value of a healthy population. Not only is this, you know, in our state constitution, this duty to promote health and welfare, but a healthy population is also essential for economic vitality. We spend a lot, both publicly and privately, on healthcare. We also know that there's a big economic impact of poor health when people have to miss work or are not able to be as productive, and the just the general cost of being sick and the toll that that takes on the economy of the state as well. So we know that there's a lot of reasons outside of just we want healthy people to invest in a healthy population. It also has this big impact on other policy areas, as I'm going to show you. All of this overlap between health policy and health and every other area of policy that you can think of. So we did a pretty thorough review of the health outcomes in Michigan, and we'll show you some of that data. There's no single measure of health outcomes, but we used some key metrics that are commonly used: life expectancy at birth, premature death, infant mortality, self-reported health status, number of poor physical and mental health days reported, and just the prevalence for various specific conditions that generally show poor or good health. And based on kind of the totality of all the things that we measured, the takeaway is that the news from Michigan, as it relates to everybody and to vulnerable populations, is not encouraging. We've mentioned it's lagging behind other states. So I'm just going to give you a few examples of some of the data points that we measured. This is a chart for life expectancy at birth in Michigan compared to other Midwest states. And you see it's not a huge difference, but Michigan does consistently lag behind over the years. The drop at the end is obviously where COVID hit. And so, but you can see it follows the same general trend, but lower than the other neighboring states and the US average. This is a chart of the average number of poor physical and mental health days per month when you're comparing Michigan to other states. And you can see the number of physically unhealthy days on the higher end, mentally unhealthy days on the higher end. So not hugely different, but we are definitely higher than some of our other neighboring states. This is self-reported good or excellent health outcome by income in the US and in Michigan. And so you can see that Michigan has worse self-reported good or excellent health by income for essentially each of the brackets, except for the higher income bracket. This is the rate of cardiovascular disease by income in Michigan and in the United States. So for each bracket of income, you can see that Michigan does worse than the US average, and it's particularly worse for those in the lowest income bracket. Infant mortality per 100,000 live births. In selected states, Michigan ranks 35th. And this is Black infant mortality rates, which shows not only just general health, but also the health disparities, which are worse in Michigan as well, which I will talk more about. So these are just some examples. Again, the report has a lot of data points that we tried to use and come to a conclusion about how is Michigan doing generally based on all of these different data points. And so we came to these three key insights. One, that Michigan has below average health outcomes relative to the national average, and the national average is typically below average among our international counterparts. Health outcomes nationwide and in Michigan are worse for certain races, people with lower levels of education, and people with lower incomes. There's also some variation by sex in some measures, and the racial disparities in Michigan are larger than the national average, particularly for the Black population. So with this in mind, the question of what does Michigan need to do to be at least in line with the national average in overall health and in terms of health disparities, and what can Michigan do to become a leader in public health and health equity? These are the kinds of questions that we want our policymakers to be thinking about. And this brings us to the conversation of social determinants of health. And essentially, they're defined in different ways, but it's an umbrella term for the social, cultural, environmental, financial, and political factors that influence a person's health. So essentially, everything that kind of has a pathway towards having an impact on people's health outcomes. And the reason that we focus on these is because it recognizes there are systemic and structural factors that can unequally or unfairly limit a person's range of options. This is just a chart to give kind of a broader overview. There's social and economic factors, health behaviors, physical environment, and clinical care. These are a huge proportion of what actually contributes to our health outcomes. And this conversation is important because it shifts our focus to be less about the individual control and health behaviors and more about what structures shape those health behaviors and what things that might be outside of individual control that is a place for policy to step in to try to improve health. The U.S. Department of Health and Human Services defines them as the conditions and the environments where people are born, live, learn, work, play, worship, and age that affect a wide range of health, functioning, and quality of life outcomes and risks. DHHS categorizes them into these 5 domains. Other organizations have kind of similar categories of economic stability, education, healthcare, neighborhood and built environment, and social and community context. So when we were writing this paper, we wanted to conceptualize it in a little bit of a different way to help policymakers get a grasp on what we mean. And so we identify them as parts of this causal pathway that create poor health and health disparities. So thinking of these social determinants of health as these fundamental resources that you need to obtain good health. And those main fundamental resources we've divided into 5 as financial resources, healthcare, food and nutrition, safety, and social support. And so I'm going to walk you through a little bit of just kind of the basic framework for social determinants of health and what we mean by these resources. And so this is a very basic chart showing you have a fundamental resource that gets you a health outcome. So for example, having access to healthcare, going to the doctor will generally give you better health outcomes than not going to the doctor. You'll be able to get assessed, get screened, get medicine for all those things you need. So we all understand that kind of basic A to B pathway. But what we want people to focus on is when you go backwards through this pathway, what else do you need to obtain that first fundamental resource that you need? So in order to have healthcare, usually you need to be able to afford it privately, or you need to be employed and get it through an employer. So there's another resource of these financial resources that you need in order to obtain the better health outcome down the line. And as we show throughout the paper, this gets more and more complicated as you keep going back and unpeeling these layers, because to get these financial resources, generally there are things that you need for that. The building blocks, generally education and employment, are things that we focus on. Those are the things that help you maintain an income, that can get employment, that can enable you to buy all of the things that you might need to achieve better health. And we'll show this a little bit more later on. Again, it gets to be very complicated as you kind of add more and more things, but this is kind of a general framework, a picture to kind of understand what we're talking about. And at the end, we will again focus back on how these financial resources tend to be at the center of this framework. So these fundamental resources, what we wanted to do was go through and measure pretty much every metric that we could find to assess how the US compares to other developed countries, how Michigan compares to the national average and neighboring states, and to analyze these disparities across demographic groups. So we really wanted to kind of figure out what data is available to show not only how are we doing health-wise, but how are we doing on all of these other social determinants of health, and where potentially is Michigan falling behind. So first we measured financial resources. We focus on direct resources in the sources of income, education and employment, and cost of living. And we have created these little boxes and charts to kind of show you the conclusions that we came to based on the totality of the data that we found. And so when you compare direct financial resources, the United States versus others, other international counterparts better than average, but Michigan compared to the US average and Michigan compared to the region does worse than average. And so while the US is one of the richest countries in the world, income is actually more unequally distributed in this country than elsewhere, and there are greater disparities across other demographics. Michigan also has below average per capita personal income relative to the rest of the country. And in some dimensions, particularly gender and race, these income disparities are greater than the national average. So this is a chart to show the per capita personal income in US, in Michigan and other Midwest states. So the lagging behind both the average and other Midwest states follows the same general trend, but lower. As a part of our assessment of financial resources, we looked at measures of education and employment to see how Michigan does there. And so when comparing education, there's a lot of different data points we used to make the conclusion that Michigan, compared to the US average and the region, is doing worse. And so some of the takeaways, US does better in attainment performance compared to other developed countries, but the disparities still exist in Black and Hispanic Latino residents and in low income brackets. Michigan lags behind the national average in post-secondary educational attainment overall, as well as student performance. And the disparities for Black students and residents in Michigan are larger than the national averages. And high school graduation rates in Michigan are worse for economically disadvantaged students than the national average. So some examples, again, this is the chart for high school graduation rates, all students versus economically disadvantaged students, comparing our neighboring states and the US average. And you can see that considerable disparity for Michigan. We also compared employment measures. We found that for the US, we're around average, but again, Michigan versus US average and Michigan versus the region, we do worse. Some of those takeaways that we found, labor participation rates in the US are relatively typical for a developed country, with those gender disparities that are generally in line with the rest of the OECD. Within the US, women, certain racial minorities, and those with lower levels of education tend to have lower rates of employment. And overall, Michigan has a lower labor participation rate than the rest of the country. In Michigan, those without a high school education, as well as Black and Hispanic Latino residents, have worse employment prospects in Michigan than their counterparts in other states. Also, millennials in Michigan are more likely to be unemployed in Michigan than elsewhere. So in addition to looking at education and employment, income, we also look at cost of living to see if that's something that is having a particular impact on Michigan, and if so, where. And so we went through a lot of different measures and categories, but the takeaway, essentially Michigan does pretty well or average for most cost of living things. Michigan does particularly worse for housing. And in general, you know, Michigan doesn't really stand out, but healthcare, transportation, and childcare are just generally very expensive in the US. So even though Michigan doesn't stand out, because the US as a whole, it's still very, very expensive. So we have analyzed those measures from our financial resources. We're going to move on to healthcare and how we measured our healthcare as a fundamental resource. We focus on access, which includes coverage and availability, quality, and cost. And so again, this chart to kind of show the takeaway of what we find, you know, Michigan does relatively well when it comes to getting people access to healthcare. Definitely getting people covered and the availability. The cost tends to be around average, and where the US you know, is worse than their counterparts is on those coverage and cost measures. But Michigan, compared to the other states, does pretty well. Michigan residents are more likely than their national counterparts to have healthcare coverage, and disparities across income and race are actually smaller in Michigan than the rest of the country. The US, however, compares poorly to other developed countries, which means the state has plenty of room to improve, even though it is better than the national average. And Michigan also does reasonably well on metrics associated with the availability of care relative to the national average. But again, the national average lags behind other developed countries. This is a percentage of total state population without health insurance in 2023, so Michigan on the lower side. quality of care. And so most measures of quality of care rely on measuring health outcomes, and that gets tricky because it's not as easy to separate that from things like access and cost of care, as well as other social determinants of health. So a little bit trickier to measure. But it seems to be the case that the direct care quality in the US compares favorably to other developed countries. Now, cost of care, again, healthcare is very expensive in the US, and a higher share of the costs are paid privately in the US compared to other developed countries. But relative to the rest of the country, Michigan's public and private healthcare costs are below the national average, and a lower share of the costs are borne directly by individuals. So the takeaway being the healthcare share of cost of living is high in the US, but not necessarily for Michiganders. It doesn't seem to be a huge focus of a problem where we are severely lagging behind other states. The third fundamental resource that we focus on is food and nutrition. So we focus on cost, availability, and knowledge and time. Do people know the right foods to eat? Do they have the time to make those healthy choices? The general comparison about how the US does to the rest of our international counterparts: we do better than average on cost, worse when it comes to availability and time. And Michigan, compared to the rest of the country and our neighboring states, do about average when it comes to cost, availability, and time. Food costs in the US and Michigan, so they don't appear in the aggregate to be an area where the country or the state is falling behind that impacts health outcomes. The US does slightly worse than its developed peers in terms of food security, but this also mainly reflects the existing income inequality that we discussed. Michigan is slightly better and slightly worse on some measures when it comes to the national average. And there's not a lot of data to assess people's nutrition knowledge, but we do know that people in the US have less time than their developed counterparts, tend to be more fast-paced, with Michigan residents sitting very close to the national average. So the next resource is safety, and this encompasses a lot of different things. Essentially, what do you need to kind of keep your mental and physical health safe? So we focus on workplace safety, transportation safety, accidents, environmental safety, violence, including community level and interpersonal violence. So we wanted to assess how Michigan does in keeping its residents safe. And this chart shows kind of where Michigan sticks out, where it does better or on average. And so of all of these things that we mentioned, Michigan really does either better or average on most of those things, at least based on the data that we are able to find. The areas that Michigan sticks out a little bit are community violence and air pollution. And so there are certain policies that could be targeted towards those in particular, but that it's unclear how much of, particularly for violence, that affects the population as a whole, as opposed to a subsect of the population. The key insights that take away from the safety fundamental resource: fatal and non-fatal workplace accidents are more common in the US than in other developed countries. The US has a higher rate of traffic fatalities, but Michigan's are actually lower than the national average. Michigan generally has lower accident mortality and is better than the national average on some measures of environmental safety, but then worse on others. Again, violent crime is more common in the US, and Michigan has higher levels of violent crime compared to the national average. And there's not much data on interpersonal violence. That's a very difficult thing to get a good grasp on. So there's only so much that we can really speak to that. This is a chart showing number of violent incidents per 100,000 residents in selected states, just to show you some data points that we use to kind of make these conclusions. The last category is social support, which can include a lot of different things. It's your social networks, your community, your culture, the stigma you encounter. And so there's a lot of factors that go into this. There's a few things that we could tangibly measure. We measured civic participation and community and social engagement, and found that on these measures, Michigan does either better or average when it comes to civic engagement and volunteering. This doesn't seem to be a place where Michigan stands out from other states in any particular way. And so not necessarily an area where we have the data to pinpoint a problem area for Michigan. Civic participation, people in the US generally seem less engaged with and more disillusioned by the government than our developed counterparts, but Michigan fares relatively well compared to other states. Michigan residents are somewhat less engaged with their communities and social circles than people in other states, but again, it's not a huge difference. So moving forward, making Michigan healthier, kind of summarizing what we learned from all of these metrics is that Michigan health outcomes need improvement. These fundamental resources have direct and indirect impacts on health outcomes. And the Michigan data on these social determinants of health shows several areas in which Michigan lags behind other states. So there's two broad themes that generally emerge from kind of taking all of this in: the interconnectedness of the social determinants of health and the centrality of financial resources in the story of Michigan's lagging health outcomes. So we're going to go through this chart again with these kind of data points and this, grounding in how Michigan is doing. And so again, we have this concept that you need various resources to access the healthcare, the food, the safety, all of those things. And there's certain ways and mechanisms in which you can achieve those resources. And a lot of them seem to overlap with each other. And so health policy intersects and depends on almost every other policy area. To improve any particular health outcome, we want policymakers to work backwards through those pathways to find the right lever of improvement. And this is what takes us to the centrality of financial resources, because as you go through these pathways, and if you ask yourself the question, okay, I need this resource, well, what do I need to get that? And what do I need to get that? And you keep peeling back that layer of, okay, well, now I need to be employed to be able to have the money. And to be employed, I need the education. And to get proper education, I need proper food and nutrition to be able to contribute and learn and pay attention. I need a safe environment. I need to be able to get to these places. So all of these things, when you peel them back, a lot of the times they tie back to whether or not the individual has the necessary financial resources to obtain them, especially when it comes to obtaining those building blocks, which is important because it's limited for those who do not already have some of those financial resources to start with. So employment and education, there's a generational wealth and privilege factor that ties into the ability to obtain even the basic building blocks for achieving the financial resources that you would then need for everything else. And while Michigan is far from perfect across all the other fundamental resources, it is very clear that this is the area where the state is falling behind. And it's important that we're focusing on this, one, because they are falling behind, but two, because of how central these financial resources appear to be when it comes to obtaining everything else. And so we highlight this in this graph, and the chart is actually much more complicated than we are able to convey, because there's all these feedback loops that factor into why you need healthcare to then get more education, why you need food and nutrition to support employment. And so why, it's hard to actually convey how much these all intersect without creating an insane picture to show you. But generally, the takeaway that it centers here on these financial resources is what we're trying to get policymakers to focus on. So the relationship between income and health outcomes is clear when comparing Michigan to other states, but it's also clear when comparing counties within Michigan to one another. And so a key way to improve health outcomes in Michigan is to improve education, employment, and income, particularly for low-income communities, those with lower educational attainment, and racial minorities. This is a chart that shows the median household income versus life expectancy at birth in Michigan County. So the general trend holds here as well. Now, this is not to say that there's no other levers of improvement, that there's no other policy areas outside of focusing on these financial resources that can make a difference. Obviously, changes to the overall US healthcare system and enhancing the healthcare workforce, these are kind of national changes that, there's only so much that Michigan can do to kind of reform healthcare system or to make those kinds of changes, but those definitely do have a large impact on health outcomes. transportation, death and injuries, community and interpersonal violence. These are kind of other areas in which the state could come in with different policies that's a little bit outside of focusing on those financial resources, but its reach might be limited. And what we have wanted to focus on is getting policymakers to focus less on the extending branches and focus more on the root of the problem. Air quality is another area in which there's only so much that Michigan itself can do, to improve air quality. There's mediation efforts, but that's something that takes more of a global policy to really implement. So the takeaway of making Michigan healthier, how do we do this and what do we want policymakers to focus on? Based on the data that we found, Michigan needs to focus on improving financial resources, both in terms of direct resources like income, but also the sources of those financial resources, education and employment. And so the key to making the population healthier is a better education system and a more robust, fair economy. And so kind of focusing on improving everyone's income, but also focusing on those health disparities as well. And we kind of leave it up to experts in different fields and policymakers to take the next steps, because that's up for debate. And so how you go about improving the financial resources of any particular population, there's a lot of different ideas about the best ways to do that. There's various research on different ways to do that, but this is where we think the conversation needs to be, because when you follow those pathways, you really connect how that public policy to health outcomes connection is very clear. And we want to highlight that and make that kind of a key focal point for conversations among policymakers and stakeholders. So that is what I have. That's my presentation. And I think Eric said you'll be able to submit questions. I'm happy to take any.
Yeah, thank you, Karley. Really good information. We have one question in so far, and I encourage others, take the time. There's a little area in the software for questions. You can just type it in and I will relay it. So it's not really a question, but a topic that somebody would like to talk about, and it sort of ties into what you just said, that we didn't really come to conclusions on what the right path is, but here's what was especially interested in the role of public transportation in the delivery of healthcare to the community, also how the lack of permanent housing for people is a big deterrent. So both speak to the root of the issue, the means of getting to healthcare, or the ability to have safe, quality housing and
right. Yeah, and I think those are two issues that you can see where they fall in that logical pathway. And there's different kinds of policy efforts that you can do when it comes to transportation and creating a transportation infrastructure for people, or there's different van services that have been promoted to get people who need to go to the doctor to be able to go. And so there's room for kind of those more specific programs to come in and try to fill in those gaps. But then that's just one potential barrier of so many others, like housing, like all of the things that we listed, that still stem from the same problem of not having the resources to obtain your own access to them. And so we don't discourage the types of policies that will zero in on transportation or housing, but we want to emphasize how much this is all connected, that all of these barriers seem to tie back to a core of a problem that also needs to be addressed, not just those branches, if you will.
Karley, your report has a decided focus on state level policy, but you can connect the dots really when you start thinking about this, the health and all policy, that we really encourage county commissioners and city councils and township boards how do we take what we've focused at the state level and sprinkle that down a little bit
Yeah,
more?
it's a good question because when we're talking about what we can do to improve kind of the economic vitality of the state and how that sprinkles down into economic vitality of individual counties, that's more of a question about kind of that relationship between, and we've talked before about the relationship between individual counties taking agency and ownership over, what they can do and how much they need to rely on the state. And so those are additional conversations that I think would be worth having, because there's that question of how much there is for a county to be able to do on its own and how much it needs to depend on the state for support. And there's, different opinions about that. So it's hard to know county by county, especially because in Michigan, we have such variation in the types of communities across our state. And so what any one particular county would be able to accomplish, it's hard to generalize because we have urban areas and we have rural areas. And so how to improve the economic vitality of an individual county is a little beyond my scope.
Yeah.
But I would imagine that they're, similar to the state, when you're prioritizing what to do with the money that you have and deciding that however we can use that money to enhance the overall economy locally and statewide is what I think everyone should be focusing on.
It's interesting when you think about the different roles. In Business Leaders for Michigan really recently put out a report, and it's the idea that for wealth building, which is really the crux of what you're trying to get to, the state role in being better at education and being better at business attraction and things like that. And that's really not the role of counties or cities or townships, but
Right.
some of these programs in lack or in lieu of wealth. So helping to create affordable housing, helping to have a viable public transportation system.
Yeah.
And like you say, the ability to afford it is questionable, right? If you're a poor community, that means you don't have a lot of tax revenue going to the city or township. But so different roles, and the idea that they need to play hand in hand, working together to achieve these things, really suggests maybe somehow everybody getting on the same marching to the same drum sort of thing.
Right. And I think that's where so much of public policy conversation tends to go awry, is a lot of times we're not grounded on the same understanding of the problem. And so public policy, discussions about solutions can go very well when we have a shared understanding of what the core of the problem is and how it kind of, trickles down to other areas, right? And so part of what I hope that this paper and a lot of the work that CRC does is to kind of ground people in what are the facts of the actual problem and what does the data actually tell us about where the root of it all is. And that I think lays that very important solid ground for any policy conversation about solutions, can bring in a lot of different stakeholders. But I personally, I tend to find that that's where some of those conversations get a little bit more, reach more roadblocks, because we can't always agree on what the problem is, but this is a very clear, we have the data to show kind of where this problem is. And so I think that in and of itself gets people to have the same kinds of conversations, and then what they can do with their own, the tools that they have as a county, as a business, as an organization, to be able to work towards that same goal.
Mm-hmm. Another question's come in. How did you come to findings about correlation with civic participation?
A civic participation, I have to remember, there's a lot of data that we used. There was various surveys from the census and AmeriCorps that we used for that civic engagement and voting participation. There were some we didn't rely that much on academic papers for this. For the voting participation, we used some academic data that had already compiled some similar things about this. I think there was some university project, and I can't remember off the top of my head, but that was comparing those kind of like official records of voter engagement in Michigan and other states. And so
I think
yeah.
the question's a little bit more upstream. Why is it, if there's strong civic participation, that there will be a healthier community?
Yeah, so there's a lot of data about social support and social connections and isolation. And so there's only certain measures that we have to show how isolated you are or how much social support and social networks you actually have access to. Civic engagement is just one of those things where we have a thing to measure, where if you are engaged, it shows that you're engaged in something. And you know, it's not to say that necessarily being engaged in that area is more powerful or a better indicator, but it's one of the indicators that we have. We don't have data on, you know, are you in a club or a social group, or, you know, there's only so much that we have to include in that. But also the idea, I imagine that, you know, connection to civic engagement as being more involved, hoping for change, wanting to contribute. Those are all things that show some connection to your community and connection to others, which in general, the trends in the research show having those kinds of connections, feeling like you're a part of a community, is correlated with better health.
All right, let me put out one last call for questions. I remind everyone that the full report is available on our website, crcmich.org, and Karley is certainly available to answer any questions offline if you want to email her, and you can go to the About link on our website and staff and find all the contact information to connect with Karley. As I said at the beginning, we have recorded this webinar. We will post it to our website. It takes a little while to process, but we'll get it online as soon as we're able to. And please remember us. This is the sort of end of year time of giving. The Citizens Research Council is a not-for-profit organization that depends on contributions from foundations, business, individuals, and anything you can do to help is greatly appreciated. I don't see any more questions coming in, so we can wrap it up and give you back a few minutes of your time. Thank you all, and enjoy the rest of your day, week, and month.
Thank you.